haven't done a car rant in a while, so I thought I'd pop on and do a video about cellulite, because I keep getting asked questions about it, especially this week. So what is it and why do we have it? Well, the doctors don't exactly have one set answer for this, but the main reason why women typically get it and men don't is because we have these fibrous bands which connect the layers of our skin through the fat cells to the layers of harder tissues underneath, so through to the layers of muscle. And our fibrous bands are straight, and through those fibrous bands you have all these circular fat cells. Then you have your skin at the top and you have your muscular layer underneath, and our bands are straight. However, men's bands are diagonally crossed over, so you can see instantly that they have a lot more support in the structure of their skin, and they're typically not as fat as women anyway. And as women, we tend to carry our fat more so through our thighs and our bum and our stomach because of our hormonal makeup, and also because we grow human beings. So there's not really too much you can do to work your way around that. Also, because we go through pregnancy and we go through childbirth, we're more likely to have damaged skin and damaged layers of fascia or connective tissue through the top layers there, because of the stretching and the weight gain and whatever else happened throughout the pregnancy and the childbirth. So I, for one, have really damaged skin through the outside of my thighs, and there's not much that you can do about that to eradicate it, but you can try to improve it, right? And then with the bands, if the bands which connect the skin to the muscle layer through the fat cells, if they are too tight, then they pull down on the skin, especially if the skin is weak and damaged. Then it's more likely and it's easier to pull and tug that skin down. And then the appearance of the fat cells up against that skin, especially if, again, it's weak and damaged, gives that bumpy shape externally. So what can we do to improve that? Well, first of all, we need to think about, if the bands are tight and they're pulling on the skin, then why can't we think about lengthening those bands? So within the Booty Kit, one of the main therapies is specifically for that, to try to lengthen out those fibrous bands. It's also going to help improve blood flow to the area, which will help improve the elastin and collagen in the area as well. And as we age, we lose elastin and collagen production through the body. Hence why as we get older, the cellulite can typically get worse as well. And again, we can't change the aging process. It's going to happen no matter what. And this is why women tend to get cellulite sometime from their mid-20s onwards, because you just have different hormonal makeups from that time on. And then from menopause onwards, your chances of having cellulite increase significantly. And up to 90% of women have cellulite, especially within that age bracket. So it's a natural part of being a woman, and it's not necessarily something that you can just take away and eradicate no matter what you do. But you can try to work on certain aspects of it. So another aspect that you could work on would be thinking about the skin and the integrity of the skin, how much elastin and collagen production you have through there. Taking a collagen powder is not going to hurt. Improving blood flow to the area to improve the quality of the skin as well is also not going to hurt. And then we have within the Booty Kit an essential oil complex which you would apply to the skin, which has been shown to improve the integrity of the skin, and it also heats up the fat cells underneath as well. You can use that in combination with the cupping therapy too for maximal results. And then you have diet and exercise obviously as well, but no matter what you do, it's important to remember that you might not necessarily be able to get rid of your cellulite, but you might be able to minimize the effect of that. So with the exercise programming, you are of course expected to follow the exercise protocols within the program, and of course they're going to help you, because if you're going to exercise and eat well, then typically your fat cells should reduce in size, and if your fat cells reduce in size, then there's less pressing up against that skin. However, you can be very slim and have cellulite, and you can be very overweight and have no cellulite whatsoever. So there's no direct link to weight being a factor for whether you will have cellulite or not. However, if you have cellulite, typically if you reduce the size of your fat cells, then that can often reduce the appearance of the cellulite. With eating, of course, if you eat well and you nourish your body, then you are again more likely to reduce the size of your fat cells too. So we will be getting some nutrition programs up on the site to go along with the training aspect as well. But it's important to remember that no matter what you do, cellulite is a normal part of being a woman, and it's not something that we can just take away, although I'm sure most of us would if we had the choice. So I hope this answers some of your questions, and yeah, it's exciting, it's coming out soon, so just stay tuned.